Hello, everyone, and thank you for taking time out of your day to join us for the AHRMM new member orientation. We realize that you are still very busy, so we appreciate you being with us today. With that in mind, we will be recording this webinar for all registrants, so if you have to step away for a bit or hop off for an urgent matter, you'll be able to access the recording. And I'll be mailing it to you, or emailing it to you rather, within the next week or so. So let's get started. My name is Kimberly Green, and I am the Member Engagement Specialist here at AHRMM. Joining us today is Averill Yu and Pete Keys, who are both on the AHRMM Membership Committee. We'll be introducing you to your new membership and going over the various benefits now available to you. So Averill, would you please introduce yourself? Sorry, Averill, I can't hear you. We may have lost Averill. Pete, are you there? Do you want to introduce yourself?
I would be happy to. Can you hear me?
Yes, I can hear you for sure.
Hey there, my name is Pete Keys. I've served in healthcare for about 19 years. I'm a retired veteran, go Navy. Now I serve in an educational setting with physician assistant students at a local university here in Gainesville, Georgia. I look forward to being able to serve you guys. And Kimberly, thank you for inviting me to serve on this call.
Of course, definitely my pleasure.
I'm sorry, Kimberly and Pete. I was on mute and I couldn't get out of it for some reason.
No worries at all. Go ahead and introduce yourself.
Sure. Hi, all. My name is Averill Yu. I'm a director with a customer success team with Premier. We are a healthcare solution and group purchasing organization that have members nationwide. I'm based out of northwest suburbs of Chicago, and I work with our members that are using supply chain tools.
Wonderful. Thank you both so much. So we invite all of you on the call today to ask any questions throughout the webinar. There's a couple ways to do this. First, you can raise your hand and verbally ask your question. To raise your hand, you would open the participant module by clicking the person icon at the bottom right side of your screen. Once the module is open, you would click on the hand icon at the bottom of the panel to raise your hand. You'll be prompted verbally and have your line unmuted to ask your question. After you've asked your question, you can lower your hand by clicking the hand icon again. The second way to ask questions is through the Q&A box, which can be found by clicking the ellipses at the bottom right-hand side of your screen, opening the Q&A box and typing your question. So let's get started. Today, we'll go over a bit about what AHRMM is as an organization, what we can do for you as an individual, what we've done for the profession and the field, as well as talk about the number of opportunities for you to get involved. We'll mostly talk about how you can take advantage of your AHRMM membership, but I wanted to touch on our mission and vision so you can get a sense of who we are as an association and what we're working toward. Our mission and vision are closely aligned, and we work every day to advance healthcare through supply chain excellence. We do that by providing education, venues for sharing and cultivating knowledge, and advocating for the profession. AHRMM has more than 3,600 individual members across the world. We are primarily focused in the United States, but we've had a lot of international growth in the last several years. AHRMM and our members represent healthcare provider organizations, as well as manufacturers, distributors, and GPOs. We also have members who are active duty military, young professionals, and students. AHRMM is governed by a 14-member advisory board. The board sets strategic goals, makes policy decisions, leads advocacy efforts, and develops relationships within the field. AHRMM is also served by 9 staff members in Chicago, including myself. We also have over 30 affiliated chapters that are independent organizations, but affiliated with AHRMM National. These self-run chapters are located across the United States and provide various resources for their members at the local and regional level.
This is April, and I'm new to AHRMM. I've been an AHRMM member for over a year now. I recently signed up for my local chapter, and if you're following with us and you have another screen, I recommend opening up and going to the website ahrmm.org. That's AHRMM.org. Click on Get Involved, and then you'll see AHRMM chapters there. You can click on the region that your state is on. For example, for me, I'm in Region 5, and we have 5 chapters in my region. The closest chapter to me is the Chicago Metro chapter. So if there's a chapter that you see there that you want to check out, please click on that website link that you see under that chapter you're interested in, or email that person listed under the chapter.
Those are very great suggestions. Thank you so much. Our chapters are a really great resource for our members. So definitely check that out as Avril suggested. So what can AHRMM do for you? We have a variety of educational opportunities in multiple formats, so you can learn in whatever style suits you best. These modes include e-learning courses, live webinars, on-demand webinar recordings, podcasts and video webcasts, and face-to-face meetings when it's safe to do so. Education topics are based on leading practices, member suggestions, and what's happening in the field right now. All our education offers continuing education credits that will enable you to renew your CMRP or other certifications you may have. You can view all our educational offerings in the Knowledge Center on our website, located on our main menu under Education and Certification. And if you're part of an organizational membership, you can receive an additional discount off the already reduced member prices depending on your organization's level of membership.
And if you are hearing that others in your organization, maybe a colleague or so, are part of AHRMM too, I suggest checking out the organizational membership. And it just needs 11 or more members since it saves money. For education, I register for webinars that I'm interested in via the emails that we get as AHRMM members. A lot of them are free. And I also listen to AHRMM podcasts. So I have an iPhone, and if you use the app, it's called Podcast. You can search for AHRMM. And the podcasts, they range in topics from setting par levels to sourcing strategies during and after COVID. And what's nice, it's only 3 to 15 minutes long. So it's nice bite-sized podcast that you can listen to when you're waiting somewhere or out for a quick walk.
And the amazing thing about this is the variety of portals provides flexibility, which allows access anytime you need to reach your professional goals. It's very, very versatile.
Thank you. Those are both really great suggestions. Thank you so much. So we did have a Q&A or a question pop up. Are there any educational sessions affiliate members cannot attend? And the answer to that is no. Our education is offered for all membership types. So it does not matter what membership type that you have. You can sign up for any of our educational sessions and receive the credits for those educational sessions as well. Good question. AHRMM's annual conference is held every summer, usually in late July or early August. If everything works out the way that we hope, in August 2021, we're headed to Boston, Massachusetts. The AHRMM Annual Conference and Exhibition is the leading education and networking event for the healthcare supply chain. AHRMM 21 promises to be packed with a variety of educational offerings, including engaging keynotes, interactive learning labs, roundtables, and quick AHRMM talks, all presented by the field's most innovative thought leaders, along with the opportunity to connect and network with your peers from around the country. We're also offering a virtual conference September 14th through the 16th, and all registration for both the in-person and virtual is on our website. Just click from the main menu, Annual Conference. We also have the safety information for the in-person conference available on the site. And again, if you are part of an organizational membership, you get an additional discount on the already discounted member registration rate. And registration will open within the next month or so.
And these conferences, they're pretty amazing. I've enjoyed the collaboration at these conferences. It provides an exciting opportunity to network and just share innovation.
Very true. Thank you. So traditional education isn't our only way of keeping our members and the industry as informed as possible. We have a multitude of other important resources and tools to help. The first is our member magazine, Supply Chain Strategies and Solutions, which is delivered to you every 2 months in print and digitally. This magazine includes articles, case studies, and leading practices, and features many other member resources. And I believe we just sent out our latest issue early last week, so that will be in your mailboxes shortly. Since March, we've been sending a coronavirus update email offering the latest updates and resources to healthcare supply chain professionals about COVID-19. This email also provides a link to our COVID-19 resources page that is updated daily. And this resource page also has our vetted supply chain vendors list. Newly updated, I might add. Our weekly e-news email focuses on developments in the field and association news. And the AHRMM Now email is sent on the first and third Thursday of the month and highlights our education and upcoming deadlines to help you make sure that you don't miss out on things coming soon. And our healthcare data standards newsletter is sent monthly and focuses on what's new in healthcare data, in the healthcare data realm. Sometimes you'll also receive special announcements and news as issues arise.
I really like the all member forum emails that we get as our members. And if you want, you can post your comments and even questions and connect with other AHRMM members for this forum via the AHRMM Connect. So on AHRMM.org, you can click on Get Involved. And again, if you're following on a separate screen there, Get Involved. And then you'll see the AHRMM Connect. You do need to log in though to get in there and post or start a discussion or take part of a discussion. I like seeing these discussions in the forum because there are approaches and angles that I've read that I didn't think of it before. So it's really kind of a nice reminder of other things that I can incorporate in my work.
Yeah, that's pretty amazing, Ava. All those forums discussions are really valuable. For me, I found that the COVID newsletter was very beneficial, and sharing these resources in our own organization are also valuable to other professionals.
Very true. Thank you so much. And I just want to kind of piggyback off of what Averill had said about logging into the AHRMM Connect. It's the same login that you would use for AHRMM.org. So you don't have to create a whole nother login. It's the same login that you would use for AHRMM.org. So just throwing that out there, make it nice and easy for everyone. As I previously mentioned, our Knowledge Center holds a wealth of information on our resource repository. It includes articles, reports, books, white papers, presentations, and programs. We also have resources from our CQO headquarters. A great benefit of AHRMM being part of the American Hospital Association is that members of AHRMM can have up to 4 hours of research conducted through the American Hospital Association Resource Center. It's a mouthful there. This resource is free and a members only benefit. The staff of the AHA Resource Center, are research experts and have access to a huge library of sources. So if there's anything you need researched, they'll work hard to provide information on whatever you request.
And the Knowledge Center and all of this, it's a great resource, especially if you have value analysis teams in your organization and you have to research projects or categories. I work with supply chain organizations in the Central and West region, and I have referred people to the AHRMM keys for KPIs. So on AHRMM.org, you can click on resources there at the top, and then you'll see AHRMM keys. There are KPIs related to finance, there's operations, patient safety, resiliency, data standards, and also environmental sustainability.
Excellent, yeah. Very current topics, that's for sure.
It looks like we've got a question in the
Yeah, I just noticed that question from Glenn. So I'm so sorry I missed that question. So the question is, how do we make sure we get the magazine and newsletters? So the best way is to just make sure your contact information is up to date and correct. I know a lot of people might be working from home currently, so make sure you have your home address in our database and you mark that as your primary address. You can also email me and we can double check your information and I can make sure that all of that is correct in the database. If you've been a member for at least a month, you should already be receiving these emails. If you have not, please email me and I will troubleshoot with you and find out where's the disconnect. So sorry I missed that question a couple of minutes ago. So we have several networking resources you can use to connect with your peers and get quick snippets of what's happening at AHRMM. AHRMM Connect is our online member community where you can ask questions, share resources, connect with other members, and do so much more. Averill and Pete have already kind of touched on that a little bit. Our online membership directory is located within AHRMM Connect, and you'll be able to find any AHRMM member and begin connections that way as well. Also, you can connect with everyone by tweeting your latest successes and news using @AHRMMTweets.
I'm not really that active in social media, but I just signed up for LinkedIn. So if you're not quite keen into signing up on a social media account, you can always connect with other AHRMM members via that AHRMM Connect and not signing up for LinkedIn or Twitter or anything else.
Hey, I'm going to jump on that. I'm going to piggyback there. I'm not terribly active on tweeting or Twitter or face page or whatever, but LinkedIn, I'm a big fan. I use it rapidly. So yeah, I think these networking resources are pretty incredible.
For sure. Thank you. In our goal to advance the healthcare supply chain, we want to make sure that you are prepared to excel in what you do and are set up for success. So we have developed career advancement opportunities and resources for you with that in mind. Our professional development matrix is a blueprint that helps to show what a career path may look like within the healthcare supply chain field. It's designed to provide some clarity around the skills required for each level: staff, supervisor, manager, director, and executive. We also want to make sure that you have an accurate picture of what the supply chain field looks like in terms of compensation. So every fall, we conduct a compensation survey comparing data from the past 4 years. The results of the 2020 survey were posted for members on the AHRMM website at the end of December. So you can find this by clicking the resources tab from our website, then click on career resources from the drop-down menu, and it's one of the options on that page.
Career Center is a great place for searching for similar professional opportunities as well.
And I do want to piggyback on what Kimberly said regarding that compensation survey report. I recently downloaded it. It's really cool information in there. Interesting information about average salary by region, by job title, education level, by your facility size. So for folks who are working in a hospital, it's broken up by bed size in there, department size. So it's good that we as our members have the option to benchmark our salary, and even better that it's free for us because we're members. Otherwise, it would cost $49.95. It's $50 for the report for non-AHRMM members.
Yeah, it's a significant savings, and I feel it's a significant benefit to being a member. So now we'll talk about the CMRP. CMRP certification is offered through the American Hospital Association's Certification Center. The AHACC is an independent body that ensures the certification is accredited and meets industry standards. The CMRP is nationally recognized, and you'll see that it's becoming more prevalent in some of the job postings in our Career Center. AHRMM offers a variety of resource materials in order to study for the CMRP. In addition, the Certification Center offers a self-assessment exam, which is a great way to determine what areas you feel confident in and which areas you feel you may want to spend a bit more time preparing for. So we just checked our CMRP, how many CMRPs we have, and currently we have just over 900. So it's a really great number so far, but we're always looking for more to join the club.
If you're looking to stand out among your peers, CMRP is one of the most difficult certifications to achieve, and it's very well respected in your peer group. Great opportunity.
Yep, and I agree, Pete. And I took my CMRP exam last year. I became member of AHRMM since it's cost effective taking the CMRP as an AHRMM member. So you get all the benefits of AHRMM with your CMRP certification. And I wish I took that CMRP sooner, since I feel like I learned more about supply chain. So if you're interested in checking it out, again, on the AHRMM website, ahrmm.org, click on Education and Certification, click on Certification, and you'll see all kinds of resources in there. For myself, I purchased a publication called CMRP Examination Review Guide, which helped me in areas that I am not as strong in, like inventory and distribution management and strategic planning.
Thank you for mentioning the review guide. Yeah, that's a lot of people find that extremely helpful when studying for the CMRP exam. And we've also had some people put together study groups for themselves in little like Microsoft Teams groups and study together. So in this day and age, I guess it's fantastic they can do it, across the country. So that's wonderful as well. Next up is the Fellow Program. So the Fellow Program is available for those AHRMM members who have had their CMRP designation for at least 2 years and are looking to elevate their status in the field beyond the CMRP. The fellow designation recognizes those who have reached the highest level of achievement in both the association and in the supply chain field. Fellow status is officially awarded during the leadership reception at the annual conference. Keep the fellow program in mind as something to consider aiming for once you've received your CMRP. And I just found out that we are just below 50 fellows within AHRMM. So we're very excited about that. And I will say, sorry, Pete. Pete just received his fellow status. So congratulations to Pete. I know you probably didn't want me to call you out there, so I'm sorry, but it's a big deal.
Thank you.
Of course. We are also happy to offer scholarships to our members to help you become CMRP certified, renew your certification, or attend the annual conference. The CMRP scholarship is offered twice a year, with the next period opening in fall 2021. AHRMM awards first-time CMRP examination scholarships and CMRP renewal scholarships. The annual conference scholarships are generously funded by our exhibiting companies. Conference scholarships will open the same day as AHRMM 21 registration, so again, within the next month or so.
Take advantage of the scholarship opportunities, professional development. It's expensive. Explore the scholarships offered at AHRMM.
So I'll also quickly highlight the work we do to advocate for you in the field. As the professional organization for the healthcare supply chain, we've been champions for various initiatives that move the field forward. One major advocacy initiative we've been at the forefront of is the Cost Quality Outcomes movement. This movement is focused on preparing supply chain professionals for the critical role they play in helping hospitals and health systems understand what drives better quality care at a more affordable cost and delivering the greatest value to patients. If you're unfamiliar with the CQO movement, definitely review the information on our website. Our CQO site has links to all the content that we've designed and developed specific to the CQO movement. There are case studies, lots of frequently asked questions, and leading practices that focus specifically around hospital-acquired infections and other areas where supply chain can contribute to improving patient care and outcomes. We also have some testimonial videos from leaders in the field and reports from events we've hosted in the past. It's a robust educational area to investigate as you're looking to learn more about the field. We also track issues and initiatives relevant to the field. AHRMM's Issues and Legislative Committee currently tracks these and other issues that affect healthcare and supply chain. The INL committee stays on top of developments on these subjects and, when appropriate, put together advocacy briefs to keep members informed of issues that can and will affect the supply chain, your facility, and the work that you do every day. These papers and briefs can be found by searching our Knowledge Center. AHRMM is currently part of several industry collaborations with the goal toward increasing quality, developing best practices, and participating in the broader conversations shaping healthcare. The Learning UDI community, or LUC, is one area of a lot of activity and industry collaboration. AHRMM is passionate about encouraging and advocating for unique device identification, or UDI adoption. The Learning UDI community helps organizations navigate UDI and implementation, the FDA's regulations, and collaboration with manufacturers. The Healthcare Learning Community, newly created Healthcare Learning Community, was modeled after the successful Learning UDI community. It will continue AHRMM's tradition as an unbiased convener with the purpose of developing solutions through the formation of cross-functional work groups made up of subject matter experts and stakeholders from across the healthcare ecosystem. You can learn more about these initiatives on our website by clicking Resources from the main menu. The recently developed AHRMM keys for supply chain excellence are key performance indicators, or KPIs, that set the standard for supply chain management in the healthcare field. The AHRMM keys are basic metrics for supply chain professionals in multiple settings to evaluate the health of your supply chain and move you closer to operating from the intersection of cost, quality, and outcomes. You can learn more about the AHRMM keys by clicking on the Resources tab from our main menu. And we'll be adding more AHRMM keys as the year progresses. I believe we just sent out an email with a survey asking about that not too long ago, maybe last week. So
I highly recommend that you check these AHRMM keys out. It's great to understand what KPIs we can incorporate in our areas to better understand and improve. So whether you're just setting up new KPIs, or maybe by checking out these AHRMM keys, there could be some additional KPIs that you can incorporate in what you already have.
And at the same time, this can lead to standardization because you're going to see what other practices are taking shape across the spectrum of supply chain.
it's a very good point, for sure. That's the hope. Practically everything we've gone over today requires our members' assistance. We are successful because of our members and the volunteers that dedicate their time, energy, and efforts into the work that we do. We have a wide range of committees where our members volunteer their time and expertise to help AHRMM improve our work and the healthcare supply chain field as a whole. If you're interested in getting to know some new people and contributing, this is the best way to get involved and contribute to the direction and the content being provided by the organization. Our 2022 call for volunteers will open up this fall.
And I encourage you all to try to be more involved. When you see that email in the fall about the call for committee volunteers, check it out and you can apply to committees you're interested in. It will ask you to pick, and I don't know if it will be the same this year, like 3 committees, and you can rank it. This is your top choice, second choice, third choice. And one of which of those 3 committees I selected is the membership committee that I'm now a part of. So the application, I feel like it's easy. It would ask you things why you're interested in a committee and how do you think you can help. I personally sentences in my application, and then if you're selected, you're notified. So it's easy peasy.
We try to make it as painless as possible, so thank you for saying it's pretty easy. There are 2 more ways to become involved. One of the most public ways is by sharing your own knowledge as an AHRMM speaker. We're always looking for subject matter experts to contribute to our e-learning courses, webinars, our shorter webcasts posted on YouTube, and podcasts. If you have expertise in a specific area, we encourage you to contact AHRMM at any time. All right, it is time for our Q&A. So if you haven't already done so, please type your question or questions into the Q&A box or raise your hand. These questions can be about any of the subjects we discussed today, which I know was a lot, or it can be anything AHRMM related. Let's see what we got. I'm not seeing, oh, let me look here. I think we got the couple Q&As that already popped up, we've already answered. And I'm not seeing any hands raised. So we may have explained everything perfectly. And if that's the case, I'm going to put up our contact information on this next screen here. This is in case you have any additional questions in the future. If you think, oh, well, I do have a question here. Oh, okay. I'll answer that on the side there, offline here. So, sorry about that. If you think of any questions later, our contact information is up on the screen. Feel free to reach out to any of us with questions about membership. Also, we do have a survey after you leave this webinar today and the presentation, so it will automatically pop up for you. If you wouldn't mind filling that out so we know in the future if we need to include something extra, or maybe we don't need to include something else, or how we did. So please go ahead and do that. We really would appreciate it. In the meantime, I think we are all set. It looks like we might get a little bit of time back in our day. And I just want to thank Averill and Pete for your participation today as co-presenters. I really appreciate it. Thank you everyone for joining us today on the call. Again, if you have any additional questions, feel free to reach out to any of us. We're happy to answer any questions. And I think we are all set. So thank you again and have a great rest of your day.
Thank you.
Thank you all. Have a good one.
You too. Bye-bye.
Bye-bye.